in this video we'll be discussing about healing of skin wounds. Okay, so we know that till now we know that healing of skin wounds is accomplished under two ways. Okay, primary union and secondary union. Okay, this is an important question in your second year MBBS, also BMS, all those having the pathology as a subject. Okay, it is a very important question. Okay, so healing of skin wounds. Now after demigrating this thing, we'll be moving towards what a primary and what a secondary union is. Primary union is also known as first intention, healing by first intention, and secondary union henceforth known as secondary intention, healing by secondary intention. So first we'll be studying about healing by primary intention. Okay, so what is healing by primary intention? Now listen, if you do like this, that primary intention, secondary intention, then it would be difficult. So directly mark a table in your examination. Okay, this will be more fruitful and more easier for the examiner also to check and give you more marks. Okay, so this is primary union, this is secondary union. We will be defining them under a few features. Okay, the first feature is cleanliness of wound. So you can now think of primary union as a child is he was running, and he was mistakenly or accidentally got hit by a blade. Okay, now how would the wound be? Okay, now we know that a blade is a sharp object, so the wound would be clean. Okay, it would be clean. And again, the same boy had slipped from a bicycle or fell from a bicycle which was speeding, then the wound would be unclean wound. Okay, all the debris and the amount of infection would be more. Second point is, first was cleanliness of wound, second would be your infection. Okay, infection. So in primary union, the wound would be generally uninfected. Okay, general. Remember, this one is the had given you the blade one, the primary union, and this one is the secondary union, which was like the boy fell from a bicycle which was speeding. Okay, so in secondary union, the infection is generally infected. Okay, it may be infected. In more suitable words, it's may be infected, may cause infection. Okay, third feature is margins. How are the margins of this primary union? They are surgically clean. Okay, now just you can imagine and answer also. How is a blade's wound? It's clean. Okay, it is a neat linear scar. Okay, regular. Okay, fourth point is sutures. Now we know that in sharp, when something gets cut by sharp objects, we do use sutures. So sutures are used, sutures obviously not used. Okay, done with sutures. Coming towards healing. Healing is scanty granulation tissue at incised gap along the suture track, at incised gap along the suture track. How is healing in secondary union? It is exuberant granulations. Sorry for the handwriting. Would improve in the future. To fill the gap. Okay, to fill the gap. Easy. Now moving towards the next point, that is the sixth point, which is outcome. So outcome in primary wound would be a neat linear scar, as I had mentioned in the earlier in this video also. And in the secondary union, it would be contracted, contracted irregular wound. Complications. So what are the complications? Infrequent cyst formation or epidermal cyst formation. This is suppuration. Okay, this is suppuration. Okay, so this was all about your primary union and secondary union. This is a very important topic and it's asked very many times in your Viva also, in your Viva examination of pathology. Okay, so do like this video. Thank you.